Right. Yes, what we're going to do is, it's obviously not going to be in real time, but we're going to simulate a player going down with a collapse, unknown. So first thing you've got to do, find out what the problem is, try and decide whether it is a cardiac arrest. Basically, that's the thing that everybody's afraid of. So, guy just collapses on the deck, and he's going to not dead. He's just like that, yeah, but faster. And so the first thing to do, we're going to check his condition, and then see whether we need a defibrillator. If he's completely unresponsive, then we obviously need to do something to help him. First thing to do, chest compressions if you suspect it is cardiac arrest. And then, unfortunately, we got the defibrillator, so that we will get that on hold as quickly as possible, so that that will then tell us what to do. The thing is fully automated, so as soon as you open the lid, it starts to give you instructions as to what to do. And then, in the meantime, somebody will be on the phone to the ambulance, get initial advice on what to do, to make sure an ambulance is on its way. So, with that in mind, right, we've got a big thing to find out. He's in that position, he's collapsed, so in order to assess him, he's got to be turned on his back. So, somebody, Malcolm, you guys help me?
Yeah.
If you just go around there. It may be he's banged his head off a post or something. So if you suspect there's a head injury, you must try and stabilise the neck. So I've got to support Bob's head while I turn him over. For the purpose of the further demonstration, we'll just assume that he hasn't knocked his head on anything. So if he had, you'd have somebody here all the time holding the neck in that position. Now we've got him over here, the first thing to do is open the airway. So that is just tilting the head back so that the mouth is open and has to stay in that position throughout. Next thing to do, find out whether he's breathing. Simple ways of doing that. Breath, hand on chest, see if any movement at all. If there's no apparent movement, then you think you've got a cardiac arrest. So at that point, you would say, defibrillator, and you go on the phone to the ambulance.
Okay.
Right. Immediately start chest compressions. I'm not going to off the chest. I'm going to use my lovely system here. I've got one of them. We're full size. Run out. So while the defibrillator's on its way, you've got to pump this 30 times at that sort of rate. Staying alive. No. We can't do it anymore. Oh, right. The compression rate has got to be about that sort of speed, and it's got to be hard enough to depress about that much. It doesn't matter, you just do the best you can. That's why it's essential you have at least 2 people on board with this. So while that's happening, got the defibrillator handy. Do the script first.
Yeah, shall I do the script?
Malcolm, read the script.
Right. While that's going on, one of us is bound to have a mobile phone with us. So I've always got one in the car, but get the mobile phone and obviously dial 999, and they will say, what service do you want? Obviously ambulance, please. And then they'll ask, what's the address? And now the address is actually in the first aid bag, because you're not going to know that off by heart, postcode. So it'll be Melbourne Park, 3G Pictures, CM1 2EH. But in the first aid bag, there will be the address of this complex. They will ask you, what's your telephone number that you're calling from? So hopefully you can remember your number. So tell them your phone number. They will ask, is the patient awake? Is the patient breathing? No, they are not breathing. Do you know the age of the patient?
Old.
And then they will be saying, we will be sending an ambulance. And then obviously 1 or 2 players here would then sort of go to the car park area to guide the ambulance in, you know. So that's what we'll be doing there.
Right. Sorry, Tom.
Yes.
Good. Just to continue from where you left off. So one of the things that you look for, apart from total unconscious, no response whatsoever, no breathing, no obvious signs of life, it could be that he's actually breathing, but he's breathing in a way which is a struggle. It's like stomach breathing. So if it's not the chest should be moving once every 6 seconds to get normal breathing. If it's got agonal breathing, the stomach will be doing the work of the lungs. He might be spluttering, coughing. So that's also a sign of possible cardiac arrest. So it's not to be ignored and assuming he's okay. He's just a bit out of breath. So you just got to watch for that. If in any doubt, then you've got to bring the defibrillator into play. So while all this is going on, chest compressions are continuing. You don't do mouth breathing anymore. That's been banned since COVID, and it's never coming back.
That's a relief.
So anybody who likes that sort of thing, sorry. So it's really just down to chest compressions. Where the essence is you've got to keep these going. So you need at least 2 people doing this while you're prepping all the rest of it. So if I just open this, just to know what it sounds like. Go back.
Stay calm and follow
Might need that myself.
emergency services. Dial number written on the device. Use only if patient is unresponsive. Remove clothes from upper body, if necessary. Tear open electrode packet located in device cover. As shown on packet, peel off the backings and apply both electrodes to upper body. Stay calm and follow instructions.
So just going back over that. The electrodes in there, take them out of the packet ready. Once you've got to expose the chest, so here's what we prepared earlier. Normally you'd have to have a scissors to cut somebody's shirt off. There's a pack containing scissors, etc. in the medical bag. So meantime, so then you've got Bob has kindly provided his own paddles because you can't use the ones in there. So the defibrillator will tell you where to place these. Right. And then from there on, it will then guide you as to what to do. It's all per instructions. All you have to do is apply the paddles and then follow what it tells you.
Stand clear of patient. Heart rhythm analysis will be performed. Analyzing heart rhythm. Shock advised. Do not touch the patient.
So you
Press
initiate the
orange
shock
button
and it
now.
doesn't rest. It'll take over the whole process.
Shock delivered. Immediately resume chest compression.
Sorry, Gerry, how do you initiate the shock?
It doesn't. On that one, it may be it will just tell you to stand clear. But some of them have got a little button. You just start it going.
I wonder if there's a button to press. I think there might be brain damage there.
Yeah, but it was like that to start with.
How could you tell?
Right. The process is then fully automatic from there on in, so that you're waiting for the ambulance to arrive. Regardless of, it will say when the further shocks are required. After that point, all you can do, if there's no obvious signs of improvement, and it's not going to do anything else, you just got to keep until the ambulance arrives. If the patient is showing signs of life again, breathing reasonably normally, just put him in the recovery position and wait for the ambulance. But other than that, you just got to keep doing whatever's necessary.